The next type of non-experimental research design is the correlational ex post facto. So from the word itself, students, correlational means to say there will be checking of relationship. All right? So there are types of correlational. We have the prospective design and the retrospective design. So this is according to the timeline when you are going to get the data. Prospective design from the present to the future, and retrospective design from the present back to the past. So prospective design, you can determine the cause and effect. Okay? For example, a researcher is conducting a prospective correlational study on effect of maternal infection during pregnancy on fetal development and pregnancy outcome. So since it's prospective, the cause in the present scenario can be studied, and in the long run, in the future, after several months of observing, you can stabilize or you can establish the effect. You call it prospective correlational design. In our setting right now, we are limited to prospective. We are not able to do prospective design because it needs significant time. It needs a lot of months to conduct and to establish effect. And we don't have the opportunity to do that at this point. But we can do retrospective design, where we already have identified the effects. The effects is visible in the present time. So we can go back to the future and analyze what is causing the effects that we are experiencing right now. So an example for a retrospective correlational study is on substance abuse. What is the factors that can be related to traumatic head injury admitted in patients in ICU with regards to substance abuse? Okay, you can go back to time and review the patient's chart about patients admitted under substance abuse and analyze the result. So if you have also some connections with hospitals, you can ask for patient charts following the specific protocols imposed. The patient chart is very rich with information. So we can study effect and go back to the cause using patient charts. Medical doctors do that. For example, they have specific patients that shows common conditions like adverse reactions about this drug. They will gather the patient charts of this group of people who manifested this ADR, and then they will study the cause of it according to the documented data in the patient chart. So you go back to the past. You call it retrospective. And when you do correlation, so that is called retrospective correlational study.